We hosted a datathon Thursday where teams had 6 hours to analyze Cosmos data and present their results. Cosmos gives you access to 300 million Epic patient records, and with the ServiceNow request, you can analyze that data using Slicer Dicer or in the data science virtual machine. In a talk at the symposium, Our Data, Your Discovery, I took the audience back in time to 2003 when I was finishing my postdoctoral fellowship and starting a faculty position at the University of Pittsburgh. My career in natural language processing was built on data that was fairly easily accessible at Pitt. The goal of the symposium, sponsored by the CTSA, was to highlight the incredible data assets we have at UT Southwestern, discuss the challenges, and demonstrate how people are building their careers, like me, and impacting healthcare with that data. A panel of health system and research leaders spoke of the data and research culture here. Here are some of the key messages that I heard. First, health systems value research, and they've invested in resources to help us do our research.
Very integral to what we do, and it's a fundamental aspect of providing the care and continuing to accelerate what we do.
There are, of course, challenges to doing research with healthcare data. The Chief Data Officer, Dr. Tammy Garrett, talked about the need to balance access with security and had some strategies for doing that. Dr. McNoon contrasted EHR data to other types of data researchers work with.
A lot of the times we think EHR data is existing data, which when we equate to other forms of existing data that we are used to handling, they usually come clean, they usually come harmonized. They have a very rigorous data dictionary, and even some codes that they'll suggest about how to go about extrapolating the data to other populations and using population weights for the sample. But EHR data is slightly different from that, right? So we need to do a lot of the harmonization ourselves.
There was consensus that most of the challenges can be overcome. Dr. Bernard from Children's Health emphasized the need to align your research with strategy and formulate your question well.
I think having a well-formulated request that both on the strategic level as well as on the data level is really helpful.
Dr. Shaw from Parkland shared a recent experience that reminded us that you need to have deep understanding of the data flow and partner with data analysts and informatics teams.
From a research mindset, if you're trying to see, okay, well, was this impactful? Give me the blood pressure. 2 weeks ago, I'd be like, yeah, just give me the blood pressure. It's obviously just blood pressure. But no, in the background, it's stored in like a dozen different spots. And so just having that understanding that the data is really, really messy, and whenever you ask for whatever you're asking for, trying to really be very specific, understand how the clinical workflow is.
Dr. Navar emphasized the need to talk with data analysts before submitting your data requests.
My suggestion would be if any data request goes in before the analyst starts working, there's a 15 or 30-minute conversation to make sure that there are no unanswered questions, to sort of talk about what could have been done better. Let's go over what's going to be easy, what's going to be hard, and what may be different than other data pulls that I've done.
The PI of the current CTSA, Dr. Toto, summarized discussions of the day with advice to partner up. We can't do research alone to address the complex problems facing healthcare today. Mujib Bassett, the CMIO for Advanced Data Analytics and the Deputy Director of the Clinical Informatics Center, was the brain behind the symposium. He said, "Today's innovative research will become tomorrow's routine. That's our hope. I see part of my role to be smoothing that pathway from research to practice through informatics tools and methods. A key element in that will be more embedding of research in operations, such as governance groups. Dr. Kadarpalli from THR explained how that's mutually beneficial."
I would say there should be some representation both on the research this and the ops that way, so that you can actually hear from the workforce and the people on the field what problems they are facing, and maybe we can frame that while we are doing operational interventions at a different level. Can we also work on some other aspects of the research that can help?
We took a Saturday morning field trip to the Arbor Hills Preserve near our house, and the Huskies got 2 rewards, a walk in the trees and a ride in the truck.